ಬಿವಿವಿ ಸಂಘದ ಸಜ್ಜಲ್ಸಿರಿ ನರ್ಸಿಂಗ್ ಕಾಲೇಜಿನಲ್ಲಿ ದೇಶದ ಎರಡನೆಯ ರಾಷ್ಟ್ರೀಯ ರೆಫರೆನ್ಸ್ ಸಿಮ್ಯುಲೇಷನ್ ಕೇಂದ್ರ ಹಾಗೂ ದೇಶದ ಪ್ರಥಮ ರಾಷ್ಟ್ರೀಯ ಮೌಲ್ಯಮಾಪನ ಮತ್ತು ಪ್ರಮಾಣೀಕರಣ ಕೇಂದ್ರದ ಉದ್ಘಾಟನೆ. ಬಿವಿವಿ ಸಂಘದ ಎಸ್. ನಿಜಲಿಂಗಪ್ಪ ಮೆಡಿಕಲ್ ಕಾಲೇಜಿನ ಆವರಣದಲ್ಲಿ ಸಜ್ಜಲ್ಸಿರಿ ನರ್ಸಿಂಗ್ ಕಾಲೇಜಿನಲ್ಲಿ ಸ್ಥಾಪಿಸಿರುವ ರಾಷ್ಟ್ರೀಯ ರೆಫರೆನ್ಸ್ ಸಿಮ್ಯುಲೇಷನ್ ಕೇಂದ್ರ ಹಾಗೂ ರಾಷ್ಟ್ರೀಯ ಮೌಲ್ಯಮಾಪನ ಮತ್ತು ಪ್ರಮಾಣೀಕರಣ ಕೇಂದ್ರವನ್ನು ಮತ್ತು ಅಂತಾರಾಷ್ಟ್ರೀಯ ಸಮ್ಮೇಳನವನ್ನು ನವದೆಹಲಿಯ ಇಂಡಿಯನ್ ನರ್ಸಿಂಗ್ ಕೌನ್ಸಿಲಿಂಗ್ ಅಧ್ಯಕ್ಷ ಡಾಕ್ಟರ್ ಟಿ. ದಿಲೀಪ್ ಕುಮಾರ್ ಅವರು ಉದ್ಘಾಟಿಸಿದರು. ರಾಜೀವ್ ಗಾಂಧಿ ಆರೋಗ್ಯ ವಿಜ್ಞಾನಗಳ ವಿಶ್ವವಿದ್ಯಾಲಯದ ಉಪಕುಲಪತಿಗಳಾದ ಡಾಕ್ಟರ್ ಭಗವಾನ್ BC ಅವರು ಮುಖ್ಯ ಅತಿಥಿಗಳಾಗಿ ಆಗಮಿಸಿದ್ದರು. ಅದ್ದೂರಿಯಾಗಿ ಜರುಗಿದ ಸಮ್ಮೇಳನದ ಅಧ್ಯಕ್ಷತೆಯನ್ನು ಬಿವಿವಿ ಸಂಘದ ಕಾರ್ಯ ಅಧ್ಯಕ್ಷರಾದ ಡಾಕ್ಟರ್ ವೀರಣ್ಣ ಚರಣತ್ಕೊಂಡವರು ವಹಿಸಿದ್ದರು. ಬಿವಿವಿ ಸಂಘದ ಗೌರವ ಕಾರ್ಯದರ್ಶಿ ಮಹೇಶ್ ಅತನಿ ಮತ್ತು ವೈದ್ಯಕೀಯ ಕಾಲೇಜುಗಳ ಆಡಳಿತ ಮಂಡಳಿಯ ಕಾರ್ಯ ಅಧ್ಯಕ್ಷ ಅಶೋಕ್ ಸಜ್ಜನ್ ಬೇವರು ವೇದಿಕೆಯಲ್ಲಿದ್ದರು. ಇದೇ ಸಂದರ್ಭದಲ್ಲಿ ನರ್ಸಿಂಗ್ ವಿಜ್ಞಾನ ಸಂಶೋಧನೆ ಹಾಗೂ ತರಬೇತಿಗಾಗಿ ವಿವಿ ಸಂಘ, ಭಾರತೀಯ ನರ್ಸಿಂಗ್ ಮಂಡಳಿ ಹಾಗೂ ಜಿಪೆಗೋ ಮತ್ತು ಳನವನ ಮೆಡಿಕಲ್ ನಡುವೆ ಒಡಂಬಡಿಕೆ ಪತ್ರವನ್ನು ವಿನಿಮಯ ಮಾಡಿಕೊಳ್ಳಲಾಯಿತು. ಸಜ್ಜಲ್ಸಿರಿ ನರ್ಸಿಂಗ್ ಕಾಲೇಜಿನ ಪ್ರಾಚಾರ್ಯ ದಿಲೀಪ್ ನಾಟೇಕರ್ ಸ್ವಾಗತಿಸಿದರು. ಸಿಮ್ಯುಲೇಷನ್ ಕೇಂದ್ರ ಮತ್ತು ಮಹತ್ವ ಕುರಿತು ಳನವನ ಮೆಡಿಕಲ್ ಮ್ಯಾನೇಜಿಂಗ್ ಡೈರೆಕ್ಟರ್ ಸಂಜೀವ್ ಸಿಂಗ್ ಮತ್ತು ಜೆಪಿಒ ಸಂಸ್ಥೆಯ ಡೆಪ್ಯೂಟಿ ಡೈರೆಕ್ಟರ್ ಡಾಕ್ಟರ್ ಕಮಲೇಶ್ ಲಾಲ್ ಚಂದಾನಿ ಪ್ರಾಸ್ತಾವಿಕ ಮಾತನಾಡಿದರು. ವಿದೇಶಗಳಿಂದ ಆಗಮಿಸಿದ ನರ್ಸಿಂಗ್ ತಜ್ಞರು ಸಿಮ್ಯುಲೇಷನ್ ಕೇಂದ್ರದ ಉದ್ಘಾಟನೆಗೊಂಡ ರಾಷ್ಟ್ರೀಯ ರೆಫರೆನ್ಸ್ ಸಿಮ್ಯುಲೇಷನ್ ಕೇಂದ್ರದಲ್ಲಿ ಡಿಸೆಂಬರ್ 5ರಿಂದ 7ರವರೆಗೆ 3 ದಿನಗಳ ಕಾಲ ಅಂತಾರಾಷ್ಟ್ರೀಯ ಸಮ್ಮೇಳನವನ್ನು ಆಯೋಜಿಸಲಾಗಿದ್ದು, ಇಂಗ್ಲೆಂಡ್, ಆಸ್ಟ್ರೇಲಿಯಾ, ಸಿಂಗಾಪುರ್ ದೇಶಗಳಿಂದ ನರ್ಸಿಂಗ್ ವಿಜ್ಞಾನ ತಜ್ಞರು ಸಮ್ಮೇಳನದಲ್ಲಿ ವಿಶೇಷ ಉಪನ್ಯಾಸ ಮತ್ತು ಶಿಬಿರಾರ್ಥಿಗಳಿಗೆ ತರಬೇತಿ ನೀಡುವರು. ಕರ್ನಾಟಕ ಮತ್ತು ವಿವಿಧ ರಾಜ್ಯಗಳಿಂದ ಒಟ್ಟು 1,000 ನರ್ಸಿಂಗ್ ಸಿಬ್ಬಂದಿ ತರಬೇತಿ ಪಡೆಯಲು ಆಗಮಿಸಿರುವರು.
And you can even take it around, you can pour water or you can even do exercises. So these are for your foundations of critical care, and Roma will be able to use this mannequin. And we have advanced mannequin subsequent use.
The beauty of this all units, the protocol of the Ministry of Health should be there. Without that, we don't want, because this again they are going to revise. By standing I can't read. They are going to make it a bigger one. So repeatedly they should read. Read them. Then only retention will be there. And many a time in the simulation what is happening is we lecture. We normally we demonstrate, we'll ask different bench people. One student will tell. They will say the lecture theatre is there. In the lecture theatre also they can watch 40 or 50 students.
ನರ್ಸಿಂಗ್ ಅವ್ರದ್ದು ಲ್ಯಾಬ್ ನೋಡಿ ಮೆಡಿಕಲ್ ಅವ್ರು ಶುರು ಮಾಡ್ತಾರೆ. ಮೆಡಿಕಲ್ ಅವ್ರದ್ದು ಶುರು ಮಾಡ್ತಾ ಇದೀವಲ್ಲ ಸರ್, 5-6 ಡಿಸ್ಟ್ರಿಕ್ಟ್ಸ್
ಬರ್ತದೆ.
Lovely to see you all. My name is Alvin. So I'm from Australia. I grew up in Hong Kong, so I can make James. So thank you for joining me today. What's the information? This is our Andy. So this is our nursing Andy. Shall we start? Yeah. Different procedures that you can do or perform on this specific mannequin. I'm from a nurse background. Yep. Alignments. You might want from the nasogastric tube. And now you will see fluid coming out actually from the tube. That creates the next level of realism, for your simulation activity. At the same time, you can also hear the breathing sound from the mannequin. So you can hear that, she's striding at the moment. If you want, you can also feel her pulses. You can actually feel the pulse on the radio. That will actually add more realism, to the student when they perform the scenario, during the training. Apart from that, we also have patient monitor. Once again, creates the realistic, for the scenario. If anyone would like to feel this, like pulses of cardiac pulse as well, they can also hear the vowel sound. So it's almost like a real patient, and they can perform on this mannequin. So it creates a very safe.
ಇದೆಲ್ಲ ಆಗ್ತಾ there is a big classroom is there. There they can allow them to practice. So otherwise if you don't have a space, ನೀವು ಮಾಡಿದ್ರೆ ಅಂತಾರ ಮಾಡಲ್ಲ, ಹೋಗ್ತಾರೆ ಅಷ್ಟೇ. So therefore everything has to be provided.
Victim injuries, the various sides.
Part of learning.
ಸರ್
the nurses and the healthcare ecosystem, healthcare system will get, beautiful. The human resource, India is going to be the human resource capital, and it is our endeavor that the human resource that goes out of India and stay inside India is of very, very high quality. And I'm sure this center will work towards that direction. ಳನವನ India is fully committed to bring this up in the most efficient and the best manner. Thank you so much.
Who is working in this field more than 15 years as a part of the JAPIGO. This is proud moment of us, and I think we are thankful to Indian Nursing Councils that we are working in collaboration with IMC and ಳನವನ for establishment of the second NRSC. And again, it's going to the next level because we were part of the establishment of the first National Simulation Reference Center that is in the Gurgaon in the university. But when he arrived, because this was my first visit, but when he arrived, it was beyond expectation. And definitely I was talking to Parthi from INC that we never imagined that I was just hearing from the Linto who is supporting this initiative from JAPIGO. But definitely since morning, the infrastructure, what I have seen, the commitment from the leadership, commitment from the owners, because they haven't compromised the quality. It's very difficult to get. And Dr. Dilip always says that many people are coming to me, but some people that we will do this, but no one says, whatever you will do, it will be done. And this is the institute where I think they have delivered the expectation. As a partner, we are technical partner. We bring the technical expertise, but investment, it needs a lots of investment to build this kind of infrastructure and lots of commitment. So my heartful thankful to the leadership and all the society members.
Historic moment happening. NRSC. Found honored to felicitate a visionary whose guidance in NRSC and Sajjalashri Institute of Nursing Sciences, Bagalkote is a tribute to his foresight and vision. Far-reaching impact of his visionary leadership. Extraordinary contribution to health national policies. I am honored to have you with us today, sir. Introduction, talent development, and building strong partnership that support ಳನವನ's global vision.
Health Sciences, BVV Sanghas, Medical College and the institutions, more than 170 institutions today, is a feather in the... He's going to develop the education system and attract all the students across the country from outside also to this part of Karnataka, who was less known earlier days for its education. And today, more visionaries and politicians like him are giving importance to education. That's the best part. And health education has really grown. I was just talking to him. We had very few colleges in North Karnataka. Earlier, when we started the university, we just had about 40-50 institutions in this part. And today, we have a large number of institutions, group of institutions, and all the local students are benefited. Especially in the field of nursing, it was a social stigma. It used to be a social stigma. We hardly used to get our own students locally to get into the nursing training, even though it's such a noble profession. And today, everyone has realized that it's part of the treating team, and without nursing team and nursing help, it's not possible to run the hospital, treat the patient, treat the human. So more and more people are getting into the courses locally, our own happy situation for all of us. Dr. Dilip Kumar, whom I know for a long time, He is an evergreen president of Indian Nursing Council and iconic figure. And I'm sure he should be continued for some more years for the yeoman service that he has rendered, the policies that he has made, the changes that he has brought in the curriculum, the recognition that he has got for the nursing education in the outside countries, and now he's been elected to the council. I'm sure he would become president, secretary one day of the International Council also with his services. And I should be personally thanking him for the kind of policies and the curriculum we are imparting in the university because of the Indian Nursing Council, especially in the field of research in the last few years, collaborative research and programs. Today, he has given us one more opportunity for our nurses to be trained in the field of skill and simulation. Everyone earlier explained how it's important to have skill labs and skill training and simulation methods. And because of Sri Veeranna Charanti Mat sir and also Dilip Natekar, I think he has chosen Bagalkot instead of Bangalore or other places as a second center in India. I really envy you, sir. Had I knew, I would have requested him to start it at Bangalore. Anyway, I assumed office a little later. It's never late. We need more and more simulation centers and skill labs across the state because we have more than 700 nursing institutions as BSc and postgraduate courses, and probably more than 600, 700 the diploma courses in the state, and we are one of the largest in India, to give nursing education, and that's how it has become popular. Luckily, we have our own Dilip Kumar sir, who is there. He is from Chitradurga, hails from Chitradurga, and he has helped Karnataka grow in this field. I'm thankful to him on behalf of Rajiv Gandhi University of Health Sciences. Dignitaries are there who put in their efforts and things. As a surgeon, I am very well aware of what simulation means to anyone doctor gets trained. It gives a very free area, a fearless field, and allows you to repeat mistakes and makes you learn, and then it is audited. Then the certification is given based on how I perform and when I am perfect. As a surgeon, I need to be number one, fearless, number two, flawless, never can do mistakes, and number three, it should be a perfect one. Repetition always leads to standardization of the procedure. Dr. Dilip Kumar explained to me each and everything when we went through the lab, right from the first step to the last step we climbed down. The best part is that they have given a very good finishing touch. From the reception, briefing and debriefing area till the cafeteria and the hostel. The facilities are excellent and really mindful and thoughtful. And if somebody walks into I think it's going to benefit more teachers than students first to get training, and then they can disseminate this training. So each teacher, each student really feel that it's like totally an institute inside. From A to Z they can learn, and when they come out they'll be really competent. The world is about competitive teaching and learning, whether it's medical side or paramedical or nursing. So every hospital today are looking at people who are trained. He was just mentioning me, people who are trained from that Delhi center they are in great demand everywhere. They are just welcomed with red carpet. So also is going to happen with the Sajjal Shri Institute. The students passed out from this institute will be definitely required by every hospital, and you have that benefit and the credit. So I again thank people who took initiative, Dilip Natekar, Charanti Mat sir and Dilip sir, and all of course from Lardal and the technical part of Japigo, right? Japago, yeah, and all the dignitaries who have come from outside to train and make you learn. Hope you will have a wonderful stay here and learn the best skills possible for the medical education and nursing education. And I wish you all the best, and thanks to the management for giving me an opportunity to address you and share my thoughts. Thank you very much.
It is truly a privilege to stand alongside you on this important occasion. It is also an honour to stand alongside Dr. T. Dilip Kumar, President, of course, of the Indian Nursing Council Stimulation Centre. Additionally, it is for me a pleasure to meet Dr. Bagan BC, Dr. Kamalesh Lalchandani, and of course, I would like to congratulate Mr. Ashok Sajan and also Dr. Dilip S. Natakar. This platform to transfer nursing education. Finally, it is a true pleasure for me, and my thanks go to the team of J. Cargo, and we cannot forget the Lairdale team, the whole team of Lairdale, including Mr. Sanjeev Singh and the other members of the Lairdale team, too numerous to mention, but they are the ones responsible for getting me here today. So, as already mentioned, my name is Carrie Hamilton, and I am a nurse. It took me 6 visa applications over the last 6 weeks to get from the United Kingdom to here right now. That's 5,000 miles away. I might also add at this point that I am dressed in a dress and wearing shoes that were purchased at 10 o'clock last night. My suitcase, full of every dress and pair of shoes possible for this event, are sitting in a suitcase at Delhi Airport. So thank you. Any compliments to my attire, well, they're just newly acquired. I'd like to give you a very brief overview of my pathway, which may help to contextualise things. I'm not here by myself as an international speaker. I'm accompanied by Laura Van Schmidt from Singapore and James Naismith from Australia. We will be taking the stage later this afternoon and will be with you for the entire weekend. So, I'm a registered nurse in 3 different countries. Yes, I've been an international nurse in 2 of them. So I sat my RN exams in the UK and then my NCLEX exams in Canada and in America. I've worked as a med-surg nurse in emergency departments in the UK and Canada and in the United States, and in intensive care units in all 3 countries. I've also worked as an expedition nurse in Africa and in in-flight medicine and tropical diseases.
Let us give a grand applause as we felicitate this visionary.
Policy decision of just I made one speech when I came to this institute. I think I gave a little detailed explanation. Think of why the simulation. At least I think the component which touched my heart when the Indian Nursing Council along with the executive members went to the Singapore Nursing Board to sign a MRA, Mutual Recognition Assessment, when all the executive committee members went to the Singapore and successfully, ours is the only regulatory body so far under the GATT agreement. You might have heard, under the GATT agreement we have to sign a lot of mutual recognition assessments with the government of India is telling to the many regulatory bodies. Except Nursing Council, nobody has signed architecture, law and medical, dental, pharmacy. The except Indian Nursing Council able to fulfill the signing the MRA, a mutual recognition assessment with Singapore Nursing Board. So when we went there, we saw this simulation. To tell you that my dream started since then. When India is going to have simulation like Singapore Nursing Board, where they are using the technology for the nursing. So I think I was the nursing advisor also at that time, and I was also holding the position of the President Indian Nursing Council. And I am telling you, literally, I was not successful as a nursing advisor and also as a president. Could not implement that, whatever the dream I developed by seeing the Singapore, the technology of training. Only after the sometime when I became exclusively the president Indian Nursing Council, so I initiated the concept and the lateral and the JPAGO. JPAGO is the I think this has brought out in such a way when we invited our Honorable Health Minister Naddaji to inaugurate our new building in the Indian Nursing Council. In my welcome speech, I said one word: Indian Nursing Council is going to have a state-of-the-art simulation center. That one sentence sent the message to the Dr. Leslie, the JPAGO CEO, the John Hopkins affiliated international NGO. They are working in 40 countries and including India. And they are working basically in the saving the lives is their motto. They are basically working in the maternal child health services. And the chief of the JPAGO is happened to be a nurse. Dr. Leslie, she is the CEO of the JPAGO. You can imagine the nursing students who are sitting here, some of the nursing professionals who are here. You can think of a nurse can reach up to become a CEO, holding such a very high position of the CEO, and it is not easy because to become a CEO of an international NGO where the process of getting funding from the different financial agencies, you should have a capacity to interact with the funders and partners. It's not easy. So and when the JPAGO was participating in the inaugural ceremony of that, the JPAGO officials sent a message to Dr. Leslie, who is sitting in the Maryland in USA. The Indian Nursing Council made the statement. So that within at least maybe within 3 to 4 weeks, I am getting a letter from the Dr. Leslie. JPAGO is going to provide the technical support for the establishment of the simulation center. That's how the process started. And you know, in India, I think to any infrastructure issue comes, it is very difficult. So we were locating, we should have a very good connectivity, air connectivity should be there, we should have a good environment, all the medical colleges, the educational institutions should be there. We were searching for a venue for establishing the simulation center. Fortunately, Dr. Chawla, who is the managing director and owner of the SGT University, and many of the senior faculty in nursing, they have appreciated the methodology which is being used there. Why the simulation? I think I would like to make for the general public to understand the pilot, the simulation, the pilot who is in the aircraft, he is the custodian of the passenger safety. So if the passenger safety who is having the custodian, So he has been trained through the process of simulators, because that's how he is acquiring the competencies as a pilot through the simulation as a method which they are trained. That's how the simulation has come to. So when from civil aviation, when he is the custodian of the passenger safety, we doctors and nurses, we are totally manipulating the working with the human body, and the patient safety is the first foremost responsibility of the doctors and nurses. So therefore, I think the relevancy of the training of this the simulation as a method of teaching is more important in the health. That's how the nurses and the medical field, the simulation is came to existence. So in that perspective, that we were able to now the government of India is also realized that how important the simulation is a method of teaching. Coming to the next area, how nursing profession is placing in a role in the international level and also at the 2020, you might have remembered the 2020, the World Health Assembly. You know, the World Health Assembly means 193 countries of the health ministers, health secretaries, director generals. All these three people, each country will have at least 10 to 15 delegations, will go to the Geneva every year in the month of May to attend the World Health Assembly, just like an assembly in the state or the parliament like that. So when they went in 2020, the Lord Nigel Crisp was happened to be the NHS National Health Services Secretary General. You know in the world, the best health services, when we ask, UK is the best NHS. This Lord Nigel Crisp worked as a secretary of the NHS. He was knowing the impact and outcome which is making in the health, the contribution of the nurses and midwives. That's why when the call came in, 2020 was to celebrate the 200-year birth anniversary of the Florence Nightingale. How to celebrate very effectively our 200-year birth anniversary of the Florence Nightingale. So he captured the evidence globally how nurses are making an impact and outcome in the health industry, like how the nurses are able to save the budget of the hospital, how the nurse-led clinics are making an outcome in the patient's outcomes, even how the midwifery-led units are making an outcome. All this evidence he captured. With that evidence, he went to the International Council for Nurses and also to the WHO. And Tedros being the Director General, he is a very passionate towards the nursing. So he took a very wise decision of, in that World Health Assembly, declared International Year of the Nurse and Midwife 2020. See, this was not given to any other profession except to the nurse and midwife WHO declared. So that shows how the World Health Organization gave an importance to the nursing profession. Unfortunately, the COVID came in. So we could not enjoy the euphoria of the WHO celebration of the International Year of the Nurse and Midwife. We could not enjoy it. So therefore, but that the COVID gave a opportunity for the nursing and midwifery professionals, how this profession is so important. Globe has realized. I think only nurses and midwives were available. Even in India, many of the doctors, professionals came and told me that, Dilip Kumar, even when the doctor who was an IAS officer was admitted in a hospital, and he was telling, nobody came to see me, even my brothers and sisters happened to be doctors, nobody came and met me, only nurses only met me, nurses only took care during COVID. So how important the nurses and midwives we could be able to demonstrate in the year of the COVID. So with a slogan. So they came up with a strategic direction for nursing and midwifery, SDNM 2021-25. They came out with a strategic direction as resolutions have been passed. And also they came out with a State of the World Nursing Report. SON report it is called, State of the World Nursing Report. That State of the Nurse World Report captured the evidences of the nurses and midwives' contribution globally. So when they passed, they sent it to all the countries. If you see that book, SON report, now the second edition, in 25 the World Health organization has released its own report 2025. But the theme of this own report was very important, very relevant to our India, and also for me, worked in the Ministry of Health for 30 years and also working as a regulator, it is more music to ears to me, whatever those themes. The first theme is investment. It is telling in that strategic direction for nursing and midwifery resolution passed by the WHO, telling the countries invest more money in nursing. I think I am seeing that investment what Dr. Viranaji is putting. This is an investment. He has put an investment of the what global WHO resolution says investment in nursing education. He is telling to the countries, he is telling to the institutions and to invest the money. So our Viranaji has invested the money in terms of it is relating to our resolution of the World Health Organization. The second the theme is creation of the nursing positions, because we nurses I think realize how we study it, we come out, but we don't implement the nurse-patient ratio in the hospital. In the absence of implementation of the nurse-patient ratio, quality dilutes. So therefore, this resolution says, telling the countries, create the nursing positions. The third theme is the leadership. They have got an evidence, a ward sister, a assistant nursing superintendent, or a director of nursing in an hospital, she has to work for one patient with a various interdisciplinary team. So once she is working with a various interdisciplinary team, if she is having a leadership skill, then she will be able to make an impact and outcome in her patient outcomes. Thus, they have got an evidence the nurses need to be trained in the leadership. So that's why the Indian Nursing Council has brought the state-of-the-art leadership for change, LFC. It is called, it is also about 50 countries, and India was the latest country we were able to after the China, because when I went and saw in China, because the LFC program is going in a big way in China. So we thought, why can't we? India should not be left behind. So we have brought that LFC program. We have trained 40 people in that LFC program. This leadership for change training program is not like only theoretical. So it gives a how in a ward, if you have an infection as a problem, how with the leadership skills you can reduce the infection rate in a ICU or in different units. So that is the leadership for change. So that concept of leadership for change has been brought into India. We have trained the 40 people, and those 40 people are going to further training and in the leadership. So that is again aligning to the theme of the World Health Organization. The last and very important theme is they have included the working conditions, because which is very important, the salary and the leaves, and also the important component of the equipments and supplies which are required for the nurses to work effectively. So it covers gamut of all these issues. Now the Ministry of Health is working on this issue, how best we can translate these resolutions passed by the WHO. Now the universal health coverage, you know that which is very important with the United Nations has passed a mandate. The India is a signatory for the universal health coverage, and WHO has said if no nurses are there, you can't achieve the universal health coverage. So therefore, the WHO has taken another policy decision that the universal health coverage, which was supposed to be the strategic direction for nursing and midwifery, is supposed to be implemented by 2025. They have extended another 5 years. WHO has extended 5 years time. That means by 2030, you have to achieve these strategic direction for nursing and midwifery. So therefore, the World Health Organization is putting more effort to the countries for implementing this own report and the strategic direction nursing and midwifery, ultimately will to impact and outcome for the reducing the infant mortality and also improve the quality of the health of the people. So in that perspective, numbers becomes very important, because you need a country require. Everybody is very happy, 39 lakhs means parliamentarians and all will be very happy you have so many nurses. But yeah, at least while working in the ministry and the president, I realized we are not having a realistic, reliable data. in the absence of a reliable data, you can't have a effective nursing manpower planning at the state level or at the national level. So therefore, Indian Nursing Council took a very important step that developing a live register. It's called Nursing Registration Tracking System, NRTS. So in this NRTS, what we have done is, it is linked to the Aadhaar. So it is linked to the Aadhaar, which is a unique identity of the country, and which is linked to this Aadhaar, and we have, the way the Aadhaar was developed, similarly we went our team to each hospital, each clinic, each nursing home to capture the data. Data means including their photograph, their educational qualifications, and also the which council they have registered. So all that we have collected. So now we have about 13 lakh nurses, the data we are having in the nursing registration tracking system. But again, this 13 lakhs, in my opinion, it is not 100%. Still many of the states required to be, some of the states have achieved 50%, some of the states have achieved the 60%. So what we are now, many people, to give one example, why we could not do it 100%, some of our nursing and midwifery professionals sitting in the regulatory bodies, telling the policy makers, in their act, the word maintenance of the nurses in a digital format, the word digital is not there. So that is the rationale they are giving it to the policy makers. Therefore, they are not doing that NRTS. Who was knowing in 1947 the computers are going to come in India and all the things are going to be done in India? Nobody was knowing at that 1947 when the acts were made after the independence. So that's why at that, but in India, it's always anything come with a policy planning from the top level. We only know how to legally, you can say that I don't want to do it, but they will give these type of excuses. But the new Nursing and Midwifery Commission bill, which has been approved and which is coming shortly, in that we have ensured that the India is going to maintain the nurses in a digital format. So that means you have to, there is no choice. There is no choice, you have to have the data. So once you have this data, you have a very good, how many nurses are available in this Bagu code, along with their qualification, along with the specialization will come up. So then it becomes an effective, and also any new private hospital which is coming up, they will be able to access the data to whom they can appoint. Now the process of the simulation center, which is the plus we have added to this Bagapur simulation center, is assessment. Once they have the assessment and certification, that becomes easily, anybody can access, oh, this person with this qualification, they have this assessment, they can appoint. So that type of qualitative assessment you will be able to get before taking a decision for appointment of the nurses. So therefore this, again we also want to